So what brings you in today?
My mother just got diagnosed with breast cancer, and I would like to know more about my risks.
I'd be happy to help. Let's start by going over some of the terms you're going to hear while we're talking about breast cancer.
Breast cancer is the uncontrolled growth of cells beginning in the breast tissue of males or females. The cancer can metastasize or spread to other parts of the body through the lymphatic or circulatory systems. Breast carcinoma is a common term that refers to cancer originating in epithelial cells that line organs and tissues. Adenocarcinoma refers to breast cancer carcinomas that begin in milk ducts and milk glands. In situ breast cancer is contained in the milk duct, while invasive breast cancer has spread beyond.
Because your mom's been diagnosed, let's talk about genetics.
BRCA1 and BRCA2 are tumor suppressor genes located on chromosomes 17 and 13 that play a large role in preventing cancer. The genes produce proteins that help repair DNA mutations that can lead to unregulated cell growth. A mutation in BRCA1 or BRCA2 can increase your risk for breast cancer because a mutated gene no longer repairs broken DNA and tumors can grow. More than 60% of women with a BRCA mutation will develop breast cancer during their lifetime, compared to 13% of the general population. If one breast has developed a tumor, there is an increased risk of developing cancer in the opposite breast.
BRCA1 and BRCA2 follow an autosomal dominant pattern. One copy of the altered gene increases the risk of developing cancer. If a child's mother or father has the mutated gene, the child has a 50% chance of inheriting the mutated gene.
The most common screening test is a mammogram, low-dose X-ray radiation of the breast. Mammograms identify changes in breast tissue such as calcifications, masses, asymmetries, and distortions. 3D mammography provides pictures that are more detailed and clear. In addition to mammography, breast ultrasounds that use sound waves and breast MRIs that use radio waves take pictures of the inside of the breast and distinguish between cysts and tumors.
There are also some new and experimental tests. In a nuclear medicine test, a small amount of radioactive material is injected into the blood to highlight any cancer cells. A special camera is used to see where the radioactive material goes. Though a very cool test, the radiation exposure required can be dangerous. In elastography, the breast is compressed slightly. Breast cancer tumors tend to be stiffer and firmer than surrounding breast tissue, so an ultrasound can show how firm a suspicious area is. In optical imaging, light is used to identify an abnormality based on the amount that can pass through the tissue. Breast cancer cells conduct electricity differently from normal cells. In electrical impedance tomography, small electrodes are taped to the skin to pass very small electrical currents through the breast.
Also, depending on your risk, you may want to consider preventative treatment. 2 out of 3 breast cancers are hormone positive. The cancer cells have estrogen or progesterone receptors that help the cancer cells grow and spread. Chemopreventative drugs like tamoxifen and raloxifene block receptors for these hormones that decrease cancer growth. Mastectomy, surgery that removes the entire breast, can be done to prevent or treat cancer. Some women that are very high risk of getting second breast cancer choose to go through a double mastectomy, which is the removal of both breasts. Another option is to have your ovaries removed because they're a main source of estrogen in the body.
Most women with breast cancer in stages 1, 2, and 3 are treated with surgery followed by radiation therapy. Radiation therapy uses high energy X rays, protons, or other particles to destroy damaging the cancerous cell's DNA, eventually causing cell death over a period of days or weeks. This option often causes fatigue, swelling, skin redness, and scarring, and make breast reconstruction more difficult. Chemotherapy drugs are often given orally or intravenously and travel through the bloodstream to target cancer cells in the body. Chemo can be given before surgery to try to shrink tumors, or after surgery to kill remaining cancer cells and prevent tumors from coming back. Taking multiple drugs improves the impact of the treatment. Negative side effects like hair loss, loss of appetite, fatigue, and low white blood cell counts are very common. Hormone therapy can also be used after surgery to decrease the risk of cancer coming back. Breast cancer is classified by the types of receptors present on the cancer cells to determine which treatments may be most effective. For example, triple negative breast cancer means the cells do not have any receptors and hormone therapy is not an option for treatment.
Immunotherapy uses the immune system to kill cancer cells. Immunotherapy can be used before or after surgery for stage 2 or 3 breast cancer. It can also be used for non-surgical recurring cancer cells and cancer that has spread to other parts of the body.
A specific form of immunotherapy is checkpoint inhibitors that block proteins like PD-1 and PD-L1 that stop the immune system from attacking. BRCA1-related tumors tend to have more DNA damage, leading to more mutations, which makes them produce more neoantigens. These are unique proteins on the surface of cancer cells which can trigger an immune response, making checkpoint inhibitors more effective.
Okay, got it. Can you help me understand how a positive breast cancer diagnosis would impact my family?
Would you find it helpful to hear from someone who can explain how breast cancer affected his family?
Yes, that would be helpful. Thank you.
How are you personally connected to the experience of breast cancer?
My wife was diagnosed with breast cancer in 2009. Over a decade, we pursued surgical options. We pursued multiple rounds of chemotherapy, and in addition to radiation and hormonal therapies.
What were discussions like as you decided on courses of treatment?
I think most of the discussions were around what was most likely to be effective and give the best chance for survival rate. And I think that we generally chose the most aggressive treatments as opposed to leaning towards things that might be easier to manage but might not necessarily be providing the same long-term effect.
How did this affect the life of you and your family?
I think it pretty much became the primary goal during treatment. That was what we were focused on at the time. It's a very invasive process in which you're healing or you're sick, so everything kind of revolves around that. So in terms of impact, it was the main focus.
How did the presence of breast cancer affect your life during periods of remission?
I think some people were able to put it aside. I think I was able to put it aside and find some consolation in the statistics, which were positive. I think my wife had a very hard time putting it aside and was always a cloud that kind of hung over her, and therefore she did a great job of continuing to raise the girls and focus on those things that are important, but I think it had a huge impact on quality of life because it was always something that she was worried about.
How did your experience with breast cancer affect your attitudes as parents of two daughters?
I think it was something for me that I tried to avoid thinking about because in times when things were not great, we were just in survival mode and focused on what we needed, and the idea of thinking that we had to not only consider about the decisions we had now, but then also at some point we might actually have to worry about this with our little girls because of an increased chance or risk was a little bit too much to handle. So unless there was something that we could do, I think I tried to avoid thinking about that. There certainly has been discussions, and we have certainly made decisions because the girls potentially have an increased risk of taking different actions than what the normal population would, whether it's, there are medical treatments in which there is hormonal therapy that's involved that we tend to shy away from because of family risk. So that's certainly something that we have thought about as the girls have gone through the years.
I know it might be stressful if I get a positive result, but I think the best choice for me would be to get my BRCA gene sequenced so I can do anything I can to stay healthy for my family.
Of course, I'm here for any questions you have, and let's get that sequencing scheduled, and we will see you soon.